Hey there. Let's talk about Viagra and what you can expect from it. First things first, Viagra is a medication used to treat erectile dysfunction by improving blood flow to the penis. Its effects can last up to 4 hours, though they tend to be strongest around the 2-hour mark. Erectile dysfunction is pretty common. It can affect men of any age and makes it tough to get or keep an erection. One major cause is a lack of sufficient blood flow to the penis. That's where Viagra comes in. It helps stimulate the blood flow necessary for an erection. So how long does Viagra last? After taking it orally, Viagra gets absorbed pretty quickly. The concentration in your blood peaks around 120 minutes after you take it, usually hitting its peak at about an hour. This means you could start feeling its effects any time during this window. Viagra tablets come in doses of 25, 50 or 100 milligrams. Interestingly, a higher dose doesn't necessarily increase the risk of side effects, but it does make the drug more effective. For most people, the effects of a 100 milligrams dose can last up to 4 hours. However, the effects are generally stronger at the 2-hour mark compared to the 4-hour mark. If you're planning on taking Viagra, it's best to do so about an hour before any sexual activity. You can take it with or without food, but keep in mind that a high-fat meal might delay its absorption, meaning it could take longer to kick in. Viagra is essentially designed to make it easier for men with erectile dysfunction to get and maintain an erection. It's a common condition affecting about 30 million men in the United States alone. Erectile dysfunction usually happens due to poor blood flow to the penis. During arousal, arteries expand to allow more blood in while veins narrow to keep it there, resulting in an erection. Viagra helps by relaxing the smooth muscles and increasing blood flow to the penis. But remember, Viagra only works when you're sexually aroused. It won't cause an erection on its own. There are also other options for treating erectile dysfunction. Viagra belongs to a class of drugs called phosphodiesterase, PDE5 inhibitors. Similar medications include Stendra, Cialis, and Levitra. Lifestyle changes can also make a big difference. Becoming more physically active, quitting smoking, losing weight, reducing alcohol consumption, or changing medications that contribute to erectile dysfunction can all help. In some cases, erectile dysfunction is linked to psychological factors like stress or depression. If that's the case, psychotherapy or counseling could be beneficial. There are also many herbal remedies and supplements claiming to treat erectile dysfunction, but there's no reliable evidence backing their effectiveness. Plus, they aren't FDA approved, so proceed with caution. So there you have it, a quick rundown on what to expect with Viagra and some alternatives to consider. Always consult your healthcare provider before starting any new treatment. Thanks for tuning in.